Healthy embryos, still no pregnancy. This was a story of a couple, 36-year-old woman and 35-year-old man, who had come to Milann having had history of repeated implantation failures. They had undergone embryo transfer with 4 good quality blastocysts, but there was no implantation and no pregnancy. Review of her case records revealed that the sperm quality, egg quality, and the embryos were looking perfectly fine. Her uterus was perfectly fine too. So then, when she came to Milann, we went ahead with doing a fresh cycle of IVF. So doctor, can you brief us about what the embryology details were and what interventions did you consider in order to try and increase the odds of her getting pregnant this time?
So as she is a case of advanced maternal age, that means she had crossed the age of 35. So what we have done is that we have extensively reviewed all her embryology records and what we found is that the embryos were looking normal. The male parameters, the female parameters, as you mentioned, everything was at par. So from the embryology side, what we had done is that we had done the genetic testing of all the blastocysts what has formed, and in fact, post testing, what we could find is that 4 blastocysts that what we have sent, and out of which 2 had come normal. That means their chromosomal integrity is maintained, whereas 2 has come abnormal. So what we have done is that, doctor, we have extensively reviewed all the embryology records, both the male and the female parameters have been looked in.
So you were left out with 2 genetically normal embryos.
Yeah. So 2 euploid embryos is what finally we got. So doctor, this is what we had done from the embryology perspective. From the clinical point of view, what is all that you have done to make sure this case fall in place?
So for a patient with recurrent implantation failure, we do certain set of investigations which would include couple karyotyping, evaluating the chromosomes of both the husband and the wife. That was normal for this couple. Then we went on to do immune evaluation in the form of ANA testing, which stands for anti-nuclear antibody testing and anti-thyroid antibody testing. To our surprise, we found that for this particular woman, the anti-nuclear antibody titer was quite high, which meant that she was rejecting the fetus, or her body was acting against her own cells.
That means the embryo is being considered as a foreign entity.
Exactly.
Yeah.
Exactly. Okay.
Yeah.
So that was probably the major issue that was going on, and we having detected that before we went ahead for the next embryo transfer, we had put her on a course of immunosuppressants, basically to try and reduce the amount of inflammation so as to increase the chance of receptivity.
Absolutely.
So under cover of immunosuppressants, we transferred 1 euploid embryo and the result was positive. 9 months later, she delivered a healthy female baby girl.
Oh, fantastic. That's great news.
Dealing with recurrent implantation failure can be a daunting task for the clinician, and for the patient, it can be emotionally very distressing. We at Milann, with our multidisciplinary team approach, targeted investigation, and personalized treatment plan, help to convert your dreams of parenthood into a reality.